And as positivity rates surge around the Bay Area, having more people vaccinated could help to slow the spread. So why aren't the holdouts getting vaccinated? KPIX 5 reporter Wilson Walker joins us live from Livermore to answer that question. Wilson?
Yeah, Liz, case numbers going up, the consequences of that loom over all of us. So the inevitable question, what can be done about the holdouts who are willfully not getting that shot? Of course, a lot of people for medical reasons cannot. Well, health officials say reaching those folks at this point is going to be a tough job.
All of this is hard work. Like, it was easy at the beginning. Everyone lined up, everyone was in line, like big cars in line. It's now, this is the hard work, like President Biden says.
Part of the hard work will be defeating misinformation. The CDC website lists a number of vaccine myths, from the absurd, magnetism, to things that could reasonably concern someone.
For example, there's a big myth, but it could sound reasonable, about infertility in young women. And that's where OBGYNs are coming out, actually, and talking about how this is not toxic. And
Dr. Monica Gandhi says the misinformation battle is just part of this.
We have to be compassionate that the messaging out there is really scary and really misinformed and really mythologic, and it's going to take time to break down those barriers.
The other holdouts present a different challenge. You are vaccinated.
I am.
Do you know anyone who's not?
Yes, I do. I got the impression that they don't feel that the government should be telling them what to do.
What would change their minds?
I don't think anything will.
And that may be the case, though health officials think one factor could drive those people to reconsider, and that is the current rise in cases.
I used to think fear wasn't the right approach, but it seems to be working for some people.
What she's referring to there is the evidence that the number of people showing up to get vaccinated in the United States started to tick up a little bit. It plateaued off a long time ago, but there's some early data that maybe the rise in cases, the concerns about the Delta variant, starting to drive some of the holdouts in. But as you heard, it's going to take a long time to fight through all of the misinformation, so don't expect these numbers to turn around dramatically anytime in the near future. We're live in Livermore. Wilson Walker, KPIX 5.